Peace be on all of you. Myself, Dr. Majid Khan, Associate Professor, Loknath, Dr. J.D. Power College of Pharmacy, Kalwan, Nasik. I welcome all of you in Lecture 2 of Antihypertensive Agent. In this Lecture 2, we will cover beta blocker, monoamine depletor, and vasodilator. Learning outcome. After completion of this topic, student able to know about the chemistry and SAR of beta blocker, understand mechanism of action and uses of monoamine depletor, understand mechanism of action of alpha agonist and vasodilator, draw the structure with IUPAC and uses of monoamine depletor vasodilator drugs. First is beta blocker. So as we know, adrenergic or sympathetic system having two receptors, alpha and beta receptor. So these are the agent which block beta receptor. So it is called as beta antagonist or beta blocker. As we see the development of this agent in 1915, a derivative of isoprenaline in which catechol hydroxyl group had been replaced by chlorine, it gave dichloroisoprenaline, that is DCI, was discovered to be a beta antagonist that blocked the effect of sympathomimetic agent on bronchodilation, uterine relaxation and heart stimulation. Although this dichloroisoprenaline had no clinical utility due to partial agonist activity, then replacement of 3,4-dichloro substituent of DCI with carbon bridge to form naphthyl ethanolamine derivative, that is pronethylol, which is introduced in 1962, but this drug was withdrawn in 1963 because of tumor induction in animal test. Shortly thereafter, it was discovered that oxymethyl bridge, that is OCH2 group, could inserted into aryl ethanolamine structure of pronethylol, and side chain have been moved or shift from carbon 2 to carbon 1, give propranolol, which is an aryl oxypropanolamine, which is the first clinical useful beta blocker. So if we see here development of beta blocker, it is a start from the isoprenaline. So it is a structure of isoprenaline, which is a agonist, adrenergic agonist. So in 1915, if we replace this hydroxyl group with chloro group, then it gives a new drug dichloroisoprenaline, which is called as DCI, dichloroisoprenaline. So it having the beta antagonist activity, but it is partial agonist, therefore not used clinically. Then if we replace this chloro group, that is 3,4-dichloro group with carbon bridge, it is a phenyl ring carbon bridge, then it gives the new drug pronethylol. So it is also beta antagonist, but due to their side effect, that is tumor induction, it is removed from the market. After that, there are two changes in the structure of this pronethylol. First changes is insertion of OCH2 group, oxymethyl bridge OCH2, so it is a OCH2 group, and shifting of this side chain from carbon 2 to carbon 1. So it give, that is, this drug is called as propranolol, which is the first marketed beta blocker. So it is a development of propranolol. So in short, first isoprenaline, which is an agonist drug, replacement of this OH group with chloro group, it gives DCI, dichloroisoprenaline, which is a partial agonist. Then this chloro group is replaced by carbon bridge, it gives pronethylol, it having beta blocker activity but having side effect. Therefore it is withdrawn from the market. After that, there are two changes. First changes is insertion of OCH2 group, and second is shifting of this side chain from 2 to carbon 1. It gives the first marketed drug propranolol. So this propranolol having a beta antagonist activity. In general, aryl oxypropanolamine are more potent beta blocker than corresponding aryl ethanolamine, and most of beta blocker currently used clinically are aryl oxypropanolamine. So here all these drugs, it is called as aryl ethanolamine. Aryl means aromatic ring, ethanol means 2 carbon with hydroxyl group, and amine means NH2 group. So these three is called as, generally called as aryl ethanolamine, while propanol is called as aryl oxypropanolamine. Here oxygen is there, therefore aryl oxypropanolamine. So aryl propoxylamine derivative is more potent than aryl ethanolamine as a beta blocker. So it is the development of propanol. Initially, it might appear that lengthening of side chain could prevent appropriate binding of a required functional group to receptor site, but later it was found that side chain was aryl oxypropanolamine can adapt conformation that places hydroxyl group and amine group into approximately the same position in space. Previously, it is thought that OCH2 group is responsible for antagonist property. However, it is not proved. Later, it was found that it is the nature of aromatic ring and its substituent is a primary determinant of beta antagonistic activity. So, the nature of aromatic ring also determines the beta receptor selectivity. So, here regarding their attachment with the receptor, previously it is thought that lengthening of side chain prevent the binding of drug with receptor, because here there is extra carbon as compared to this type of compound. So previously it is thought that this lengthening of chain decrease the binding with receptor, but it is found that this side chain adapt a conformation due to which the OH group and other important group occupy same position as these drug occupy. Second thought is that this OCH2 group which is inserted, it is responsible for beta blocker activity, but it is after it is proved that it is not responsible for beta blocker activity, but it is the substituent on this aromatic ring is important for activity. One common structural feature of many used selective antagonists is the presence of para substitution of sufficient size or aromatic ring with absence of meta position. So for binding, the important point is substituent on this aromatic ring. So here there is a para substitution in case of practolol. So it is also beta blocker. Then stereochemistry of beta blocker. So as we seen in second year semester 4, that is ethanolamine. So it is a aryl ethanolamine which is a agonist like adrenaline, non-adrenaline. It is a aryl ethanolamine and which is a agonist which bind to alpha and beta receptor. So in order to give agonist activity of this aryl ethanolamine having the R configuration is important. When aryl ethanolamine which is the agonist having the R configuration, then this hydroxyl group, this amine group and this ring is in proper position so that it properly bind to receptor. In short, agonist drug, that is aryl ethanolamine agonist drug, when it is in R configuration, it give more activity as compared to S, because in this configuration it properly fit to their receptor. But in case of aryl oxypropanolamine, it is also bind to same receptor, that is beta receptor, but it produce the antagonistic activity. But here we inserted OCH2 group, therefore the CIP rule changes and it show the S configuration. So this type of drug, that is aryl oxypropanolamine, when bind to beta receptor, when it is in S configuration, then it is more potent as compared to S. In short, agonist drug, which is a aryl ethanolamine, when it show R configuration, it properly bind to their receptor and produce agonistic activity. But in case of aryl propanolamine, it is an antagonist. It bind to beta receptor and block that receptor. But here the configuration is changed S. Why change? Because of this insertion of OCH2 group. So because of this insertion of oxygen atom inside chain of aryl oxypropanolamine, CIP priority of subsequent around asymmetric carbon changes, and isomer with a required special arrangement now has S configuration. So in summary, for agonistic activity, the compound should have the R configuration, but for antagonistic property, as in case of aryl oxypropanolamine, they show the S configuration. So it is about the stereochemistry of beta blocker. Now SAR of beta blocker. First point, aromatic ring may be phenyl, like example atenolol, practolol, esmolol, metoprolol, or it may be indol, in bracket, that is example is pindolol, or it may be thiodiazole, example timolol, or it may be reduced naphthyl, in bracket, that is example nadolol. So aromatic ring may be different types, may be phenyl, may be indol, may be thiodiazole, may be reduced naphthyl. Second point, oxypropanol unit is essential for antagonism. Replacement of this OCH2 group by CH2, OCH2, CH2, or NH2, usually loss of potency. So as we see in development of beta blocker, we inserted OCH2 group. So if we replace this OCH2 group with other group, activities decreases. Third point, the configuration of hydroxyl bearing carbon is critical. This carbon must possess N configuration for optimum activity. The enantiomer with R configuration is 100 times less potent. However, currently timolol, penbutylol are used in pure S enantiomer. So as we seen previously in stereochemistry, this aryl oxypropanolamine should show S configuration for maximum potency. Therefore, S configuration drugs show more activity as compared to R. Fourth point, the amine function is always secondary. The commonly used alkyl group are isopropyl and terbutyl group. So it is about the SAR. Now individual drug, that is first one is propranolol. So first IUPAC name. So 1 isopropyl amino 3 naphthoxy 2 propanol. So here the numbering is given 1 2 3, that is propane with hydroxyl group propanolamine. So 1 isopropyl, so 1 means this isopropyl group is there, isopropyl amino group on 1 position. On third position this ring is attached, that is naphthoxy, naphthyl with oxygen, naphthoxy, and 2 propanol. On second position hydroxyl group is there. Therefore IUPAC name 1 isopropyl amino 3 naphthoxy 2 propanol. Uses, it is used in hypertension, angina pectoris and myocardial infarction. Tachycardia associated with various conditions including anxiety, panic, hyperthyroidism and lithium therapy. So propranolol also used for tachycardia, means increase in the heart rate, which may be associated with anxiety, hyperthyroidism and lithium therapy. Lithium therapy, it is a therapy for mania, mental disorder. Propranolol also used in portal hypertension to lower the portal vein pressure. Portal hypertension means when there is an increase in blood pressure in portal vein. So it is also used for that purpose. Similarly, it is used for prevention of esophageal variceal, that is abnormal enlarged vein in the tube that connect throat and stomach. Then also used in bleeding, anxiety, hypertrophic cardiomyopathy, means it is a condition in which portion of the heart become thickened and therefore it does not pump the blood properly and it produces the hypertension. So these are the main uses of propranolol. Next drug is timolol. So timolol, also here there is a numbering 1 2 3, that is 1 2 3. So 3 carbon with hydroxyl group, again propanol. Here there is a numbering, start from sulfur 1, then this nitrogen 2, then attachment 3, then 4, and this nitrogen is 5. So 1 terbutyl amino, so it is a terbutyl amino group attached on this 1 carbon. Then on third position, so it is a third position, this total structure is 4 morpholine, so it is a morpholine on fourth position. According to this ring, it is the fourth position. 4 morpholine, 4 eel, so it is a 4 eel attachment. 1 to 5 thiadiazole oxy, so 1 to 5, so on one position there is the sulfur, 2 and 5 position there are nitrogens, so it is a thiadiazole with oxygen, thiadiazole oxy, 3 eel attachment, and basic chain is 2 propanol. So IUPAC name 1 terbutyl amino, 3 4 morpholine, 4 eel, 1 to 5 thiadiazole oxy, 3 eel, 2 propanol. Uses by mouth form, it is used to treat high blood pressure, to prevent the heart attack, to prevent the migraine headache. In eye drop form, it is used to treat open angle and occasionally secondary glaucoma. So glaucoma, it is eye disease in which intraocular pressure is increased. The mechanism of action of timolol is probably the reduction of formation of aqueous humor. Aqueous humor means it is a water in eye, that is called as aqueous humor. So when there is an increase the amount of aqueous humor, then it increases the intraocular pressure, which leads to glaucoma. So this drug decreases the aqueous humor and therefore used in glaucoma. Next drug, atenolol. So the IUPAC name of this atenolol numbering is given. So here is acetamide, this one is acetamide. So 2 means this 2, it is a 2. 4 means this 4. Then 2 hydroxy means this 2 hydroxy. 3 isopropyl amino, this one is 3 isopropyl amino. Propoxy means propane with oxygen, propoxy. Phenyl means this phenyl ring, and basic is acetamide. So IUPAC name 2 4 2 hydroxy, 3 isopropyl amino, propoxy, phenyl, acetamide. Uses atenolol is used for number of conditions including hypertension, angina, acute myocardial infarction, supraventricular tachycardia, that is increase in heart rate due to ventricle problem, and the symptom of alcohol withdrawal. So this drug also used in case of symptom of alcohol withdrawal. It means when there is addiction of alcohol to someone, then if we not given the alcohol to that patient, then it body shows the various symptoms. It is called as alcohol withdrawal symptoms. So this drug also used for alcohol withdrawal symptoms. Now next class as antihypertensive adrenergic neuron blocking agent called as monoamine depletor. So first we see the mechanism of this type of drug. So as name indicates, monoamine depletor means it decreases the concentration of monoamines, especially in noradrenaline. So if we see the mechanism, as we know, non-adrenaline releases into synaptic cleft. Once non-adrenaline exerted its effect at adrenergic receptor, there is a mechanism for removing of non-adrenaline from synaptic cleft and terminating its action at receptor, and this mechanism include reuptake of non-adrenaline into presynaptic neuron by non-adrenaline transporter. Then Second mechanism is conversion of non-adrenaline inactive metabolite by MAO enzyme and COMT enzyme. And third one is diffusion of non-adrenaline away from synapses. So any neurotransmitter after release into synaptic cleft and after producing its effect, the action of that neurotransmitter is terminated. So here the neurotransmitter is noradrenaline. So normally non-adrenaline releases into synaptic cleft. Some part of non-adrenaline bind to their receptor which is present on the postsynaptic receptor. Some part is washed out in blood. Some non-adrenaline is reuptake into synaptic from the synaptic cleft to into neuron. So there is a reuptake process. Some are metabolized by their enzyme. So here enzyme is MAO and COMT, catechol O methyl transferase. So here the important is a reuptake process. After release into synaptic cleft, some part of non-adrenaline is reuptake into presynaptic neuron. For reuptake, there are various transporter. So in case of non-adrenaline, the transporter is called as NET. NET means non-epinephrine transporter. Similarly, for dopamine, there is a transporter called as DAT, DAT, dopamine transporter. For serotonin, there is a transporter SERT, serotonin transporter. So there are various transporter for the different neurotransmitter. So here is noradrenaline. After release into synaptic cleft, it reuptake by the transporter called as a NET, non-epinephrine transporter. So from synaptic cleft, it is transported here the cytoplasm of neuron. So it is a non-adrenaline in cytoplasm. Then from this cytoplasm, non-adrenaline is transported into storage vesicle by the enzyme VMAT. So VMAT means vesicular monoamine transporter. So this VMAT is responsible for transformation of noradrenaline from cytoplasm into storage vesicle. So these drug that is called as monoamine depletor bind extremely tightly and block this VMAT. So it is a target of this drug. So this VMAT is responsible for transport of non-adrenaline from cytoplasm to storage vesicle. So this drug that is called as adrenergic neuron blocking agent or called as monoamine depletor block this VMAT and therefore block the storage of non-adrenaline. So there is no storage of non-adrenaline in storage vesicle, and this remaining non-adrenaline which is present in cytoplasm is metabolized by the MAO enzyme, and automatically there is a decrease the level of non-adrenaline from their storage site. So the end result is depletion of non-adrenaline in sympathetic neuron. Reserpine bind to storage vesicle membrane, causes storage granule destruction and reducing its ability to concentrate and store non-adrenaline. Because reserpine act on both central and peripheral adrenergic neuron, its antihypertensive effect may result from non-adrenaline depletion from both of these sites. So reserpine is an example of this category, monoamine depletor. So the target for monoamine depletor is VMAT. So it is about the mechanism of action of these drug. So in that category there is a drug is that is guanethidine. So it is a structure of guanethidine, IUPAC name 2,2-azucane. Azucane means nitrogen with 8 member ring. 1 is ethyl guanidine. So it is a ethyl 2 carbon and this one is guanidine. Uses guanethidine was once a mainstay for hypertension resistance to other agent and was often used safely during pregnancy, but it is no longer used in the US due to lack of availability. So it has limited use as an antihypertensive agent. The main drug of this category is that is reserpine. So it is the structure of reserpine. Reserpine is a drug that is used for the treatment of high blood pressure, usually in combination with thiazide diuretic or vasodilator. Although the use of reserpine as a solo drug has declined since it was the first approved by FDA in 1955, a review recommended use of reserpine and thiazide diuretic or vasodilator in patients who do not achieve adequate lowering blood pressure with first-line drug treatment alone. The reserpine hydrochlorothiazide combo pill was the 17th most commonly prescribed of 43 combination antihypertensive pill available in 2012. So it is the use of reserpine. So it is about the monoamine depletor. Next class is alpha agonist. The example is clonidine. So it is the structure of clonidine, which is the alpha agonist. IUPAC name of this clonidine, that is N. N means this N. 2,6-dichlorophenyl. It is a 2,6-dichlorophenyl. 4,5-dihydroimidazole. So it is a 4,5-dihydroimidazole. 2 amines. So 2 amines. So it is the IUPAC name of clonidine. Mechanism of action. Clonidine treat high blood pressure by stimulating alpha-2 receptor in the brain stem, which decrease peripheral vascular resistance, lowering blood pressure. It has specificity towards the presynaptic alpha-2 receptor in the vasomotor center in brain stem. The binding has sympatholytic effect, suppress release of non-epinephrine. So clonidine act on alpha-2 receptor as a agonist, therefore produce the vasodilation or it decrease the non-adenine level from the brain. Uses. Clonidine used to treat high blood pressure, drug withdrawal symptoms like alcohol, opioid or smoking withdrawal symptom, menopausal flushing, diarrhea and certain pain conditions. So it is the main uses of clonidine as a alpha agonist. Next category is vasodilator. Example is hydralazine. So it is direct acting smooth muscle relaxant and act as a vasodilator primarily in resistance arterioles. By relaxing vascular smooth muscle, vasodilator act to decrease peripheral resistance, thereby lowering the blood pressure and decrease the afterload. Hydralazine is not used as a primary drug for treating hypertension because it elicits a reflex sympathetic stimulation of heart, that is baroreceptor reflex. This baroreceptor reflex, mainly aorta. On aorta there is a special receptor which called as a sensor to control the vasodilation and vasoconstriction and therefore control the blood pressure. So hydralazine not used alone because it has the effect on this baroreceptor reflex which act as a sensor to control the blood pressure. The sympathetic stimulation may increase the heart rate, cardiac output, or in people with coronary artery disease may cause angina pectoris or myocardial infarction. So because this baroreceptor reflex is important in controlling the blood pressure, hydralazine affects this baroreceptor reflexes and may be dangerous when used alone. Hydralazine may also increase plasma renin concentration, resulting in fluid retention. To prevent this undesirable effect, hydralazine is used prescribed in combination with beta blocker, propranolol, and with diuretic. Hydralazine is commonly used in combination with isosorbide dinitrate for treatment of congestive heart failure. IUPAC name of this hydralazine is 1-hydrazenyl thalazine. So it is a thalazine ring on one position hydrazenyl group. So 1-hydrazenyl thalazine. So it is a vasodilator. It simply dilate the blood vessels. So it is about the important class of drug which use as a antihypertensive. Thank you. If you like the video, please subscribe the channel. In next video, that is in lecture 3, we will see about the important antihypertensive agent called as ACE inhibitor. So once again, thank you very much.